We all know we should keep an eye on our cholesterol, but what's the best way to monitor and manage cholesterol? For the first time in more than 2 decades, new guidelines are out in the U.S., and they turn previous cholesterol guidelines on their head. Global National's health specialist, Dr. Zentner, joins us now. First of all, what is cholesterol, how is it measured, and who needs to be screened?
So cholesterol is essentially just that. It's a fat that exists in our blood. It's used as a building block. It's actually very necessary, used as a building block for making most hormones, produced by our liver, but also taken in from some of the foods that we eat. How cholesterol is measured is through a blood test, and there's typically 4 things we look at. There's total cholesterol, there's HDL cholesterol, which is the good cholesterol, LDL cholesterol, which is bad cholesterol that's typically most responsible for forming plaques in our blood vessels, and then there's triglycerides, which are typically sort of a sugary fat. Both LDL cholesterol and triglycerides are often about 80% genetically predetermined.
So who should be screened?
Who should be screened is women over the age of 50 and high-risk people, so people with other comorbidities such as high blood pressure, people who have a family history of high cholesterol, people who struggle with obesity, and certain other diseases, and then men over 40. So there's an all-comer screening and then specific screening for people who might be at high risk.
Now let's talk about these American guidelines. Will they influence Canadian guidelines?
You know, the biggest change in the American guidelines was that they asked for an assessment of risk, so separating patients into low, medium, and high risk based on a risk scoring system. We already do that in Canada, so we already have risk assessments based on low, medium, and high risk. And then the big change among the American guidelines was that you did no longer treat to targets of cholesterol, that you actually just prescribed a specific dose of medication based on a person's risk. Do I think Canadian guidelines will do that? No. In fact, Canada just recently revamped its guidelines last year and actually had a treat to target phenomenon based on a variety of evidence.
The criticism of these new guidelines is that there's too much emphasis being put on medication. What do you think of that?
You know, I think when it comes to any disease, I think pharmacotherapy, I'm biased, I'm a physician, I think pharmacotherapy absolutely plays a role. We know that 80% of cholesterol is genetics, so obviously medication is going to play a role. That doesn't diminish the importance of lifestyle modification of diet and exercise. Do I think these guidelines are going to push for more medication? No, I think we're going to be treating more people who should be treated and actually refraining from treating lower risk patients.
All right, Dr. Zentner, thanks so much.
Thank you.